Doc Allen podcast. We're excited to welcome Royal Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic, transverse lie in pregnancy. What is a transverse lie?
Well, you have several choices for how a baby lies in the uterus, but for some moms, especially who have had many babies, and if their abdomen is a little bit floppier, the baby tends to be transverse, which means this way instead of this way. In other words, the head is on one side and the butt is on the other side. But one of the problems with that is if sometimes the transverse lie can have the feet up, sometimes it can have the feet down.
Is a transverse lie unusual?
Well, it is pretty uncommon, and for the most part, the head will turn down when mom goes into labor. Occasionally, you'll get a breech, but for the most part, this transverse lie will turn into a deliverable presentation spontaneously.
What is the present treatment for a transverse lie?
Well, for the most part, we would say observation. Years ago, when I had my first practice, the old doctor said, the best thing for you to do with your hands is to sit on them, which of course meant sometimes you should do nothing. And for a young doctor, it's really hard to do nothing because we're trained to do things, but we're not always trained about why we should do the things we've learned to do. So learning the why is sometimes kind of hard, but for the most part, let nature take its course. That works out best for everybody.
Why not turn the baby with an external cephalic version?
Well, for the most part, a transverse lie turns itself, so an ECV is not necessary.
What happens if the mom presents in labor with transverse lie?
Well, that depends how much labor there is and what's going on with the cervix and where the placenta is. But if you don't have a placenta previa and mom isn't really developed in labor and you can get a hold of the baby, and you can actually turn the baby to be head down and try that. You can also try to get the baby to be butt down. And if the baby is transverse lie with the feet down, some of the older doctors would have just broken the membranes when the cervix got complete and grab onto the feet. They used to say feet make nice handles.
All right. The best place to go is worlddocallen.com, safepregnancies.foundation.org, and worlddocallenpodcast.com. Thanks, Doc.
Yes, thank you, Neil. Lots of tongue twisters there.
Yes, you're listening. That was the Royal Doc Allen podcast, guys. Take care.